Hello and welcome to my channel. In this video we will be looking at failure to function adequately, which you need to know for AQA A-level psychology in the subtopic of psychopathology. I hope you enjoy this video and find it helpful. Let's get started. Failure to function adequately is a definition of abnormality, defined as abnormal behavior that causes personal distress or distress to others and anguish or inability to cope and deal with the demands of everyday life and living. Rosenhan and Seligman, 1989, suggested 7 criteria that are typical of FFA, including personal distress, anxiety, depression and fear, unpredictability, displaying unexpected behaviors and loss of control, irrationality, vividness, observer discomfort, violation of moral standards and maladaptive and dangerous behavior. The more features of personal dysfunction a person has, the more they are considered abnormal. To assess how well individuals cope with everyday life, clinicians use the Global Assessment of Functioning Scale, GAF, which quantifiably rates a person's level of social, occupational, and psychological functioning on a scale of 0 to 100 and the extent to which a mental disorder affects an individual's ability to function adequately. A person who scores highly, e.g. 80+, will have few if any symptoms that prevent their ability to function, whereas a person with a very low score, less than 20, will struggle in society and may even be a danger to themselves or others. A strength of failure to function adequately as a definition of abnormality is that it provides a threshold for professional help for those who need it most. This approach focuses on the observable behaviors and daily functioning of a person, which can be more straightforward to assess than subjective measures of mental health. For example, if someone is unable to maintain basic self-care, hold down a job, or engage in social interactions, it signals that they might be struggling significantly with their mental health. This definition can help clinicians prioritize their resources and interventions for those who are most at risk or in need of support. By establishing a clear criterion, it also helps reduce ambiguity in diagnosing mental health issues, making it easier for individuals to receive the help they require. Additionally, this approach emphasizes the importance of functionality in everyday life, which is a practical consideration in mental health treatment. It can lead to more targeted therapies and support systems that address the specific challenges faced by those who are struggling. This is a strength because it suggests that mental health professionals can more effectively identify individuals who are struggling and in need of intervention. By focusing on observable behaviors and daily functioning, it allows for a clearer understanding of an individual's challenges and the impact of their mental health on their day-to-day life. This clarity can lead to more appropriate and timely support, ultimately improving the overall well-being of those affected. A strength of failure to function adequately as a definition of abnormality is that it recognizes the subjective patient's perspective. This definition takes a patient-centered view by allowing mental disorders to be regarded from the perception of sufferers. An individual who may be struggling to function adequately and wishes to seek intervention can do so based on their own experiences and feelings. This approach emphasizes the importance of personal insight into one's mental health and acknowledges that individuals are the best judges of their own functioning. By focusing on how well a person is coping with daily life and their ability to fulfill personal and social roles, this definition can lead to more tailored and relevant treatment options. It also empowers individuals to take an active role in their mental health care, as they can express their struggles and needs, fostering a more collaborative relationship with mental health professionals. Furthermore, this perspective can help reduce stigma, as it validates the experiences of those who may feel marginalized or misunderstood by more rigid definitions of mental health. This is a strength because it suggests that mental health assessments should be grounded in the lived experiences of individuals, allowing for a more nuanced understanding of their struggles. By prioritizing the subjective perspective, it acknowledges that each person's definition of functioning can vary greatly, leading to more empathetic and effective treatment approaches. This focus on personal insight helps to ensure that interventions are relevant and supportive, ultimately promoting better mental health outcomes. A limitation of failure to function adequately as a definition of abnormality is that it may be a normal reaction to a traumatic event, such as bereavement or grief. In these situations, individuals may experience significant emotional distress and a temporary inability to function in their daily lives, which is a natural response to loss. This definition might label such reactions as abnormal, potentially leading to unnecessary concern or intervention when, in fact, these responses are part of the human experience. It fails to distinguish between a transient reaction to a specific event and a more chronic mental health issue. This is a limitation because it suggests that the criteria for defining abnormality may overlook the complexities of human behavior and emotional responses. By labeling certain reactions as inadequate, it fails to account for the context in which these behaviors occur, such as in response to significant life events. This can lead to misinterpretations of an individual's mental health status and may not consider that temporary dysfunction can be a normal part of coping with trauma or loss. Consequently, it risks pathologisting natural human experiences, which could hinder appropriate support and understanding. A limitation of failure to function adequately as a definition of abnormality is that some people appear to function adequately despite being seriously ill. Abnormality may not always be followed by observable dysfunctional traits. For example, Harold Shipman, an English doctor who murdered over 200 of his patients, was clearly abnormal and a psychopath, but he displayed no signs of dysfunctional behavior or inability to function. This highlights a crucial flaw in the definition. It may fail to identify individuals who are dangerous or have severe psychological issues but manage to maintain a facade of normalcy in their daily lives. Psychopathy is a particularly insidious personality disorder, as it is characterized by manipulative behavior, lack of empathy, and antisocial tendencies, yet individuals with this disorder can often appear charming and fully functional. This is a limitation because it suggests that the definition of abnormality may not adequately capture the full spectrum of mental health issues. Individuals who function adequately despite serious underlying conditions can easily go unnoticed, leading to a lack of necessary intervention. This oversight can have serious implications, especially when it comes to identifying individuals who may pose a risk to themselves or others, as their outward normalcy can mask their true psychological state. A limitation of failure to function adequately as a definition of abnormality is that some behaviors considered maladaptive are not necessarily indicative of psychological abnormality or mental illness. For instance, smoking is widely recognized as a harmful behavior that can lead to serious health issues, yet many individuals who smoke are able to maintain their daily lives and responsibilities effectively. This raises questions about the validity of using dysfunction as a primary measure of abnormality. Moreover, the definition can sometimes pathologize behaviors that are socially accepted or culturally normative. For example, certain coping mechanisms, even if they seem maladaptive, may be employed by individuals to navigate stress or trauma without indicating a deeper psychological disorder. This is a limitation because it suggests that the definition of failure to function adequately may not account for the full range of human experiences. It implies that any behavior deemed maladaptive automatically indicates psychological abnormality, which isn't always the case. For example, behaviors like smoking can be harmful but don't necessarily reflect a mental illness, as many individuals can still function well in their daily lives. This raises concerns about the effectiveness of using dysfunction as the sole criterion for determining abnormality, as it can overlook the complexities and nuances of individual circumstances and coping strategies. A limitation of failure to function adequately as a definition of abnormality is that it is highly context-dependent. For example, not eating is generally considered a sign of dysfunction, as it can lead to serious health consequences and indicate a potential psychological issue. However, in the case of prisoners on hunger strikes, this behavior takes on a different meaning. Their choice to abstain from food is often a form of protest against their conditions or treatment, which reflects a conscious and purposeful decision rather than a sign of psychological abnormality. This definition may overlook the motivations and circumstances behind certain behaviors, leading to potential misdiagnosis or misunderstanding of individuals' actions. This is a limitation because it suggests that the definition of failure to function adequately may not fully capture the complexities of individual experiences. It implies that any behavior deemed as not functioning properly is automatically classified as abnormal, which can lead to overlooking the subjective perspectives of those experiencing these difficulties. For instance, someone who is unable to perform daily tasks might be viewed as having a mental disorder, but their situation could be influenced by various external factors or personal choices that are not taken into account. This highlights the need for a more nuanced understanding of abnormality that considers context and individual motivations. Thank you for watching. If you have enjoyed this video, please like and subscribe for more content like this. Bye.